Attendees are in listen-only mode.
Hello and welcome to the County Health Rankings and Roadmaps 101 webinar with a tour of our website. My name is Mary Bennett and I'm a community coach with the County Health Rankings and Roadmaps, and I'm joined by my colleague Kate Conkle.
Hi everybody.
First, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. As with many of you, this program is the result of the contribution of many partners, including those listed here.
So we're going to take a moment to get you oriented to the technology that we're using today. This is the GoToWebinar attendee interface, and it's made up of two parts. On the left, you can see our viewer window, and that's where you'll see the slides throughout the presentation. And on the right, you can see the control panel. This is where you can interact with us. Because of the number of people we have on today's webinar, as usual, we will be taking questions through the control panel. So feel free to enter your questions at any point in time into that control panel, and we will answer them either throughout the webinar or towards the end as time allows. And I may be responding to some of you just via that question box.
Thanks, Kate. So here's a look at what we're going to talk about today. We'll start with an overview of the County Health Rankings and Roadmaps program. Then we'll demonstrate how you can use our site to explore the rankings data. We'll also talk about tools for taking action and take a look at how the Roadmaps Action Center can help you move forward with action and how you can learn from others. Throughout the webinar, we'll head over to the countyhealthrankings.org to see how the site functions, so you'll walk away from today's webinar confident in navigating the site. As we go through the webinar, if you have an idea or thought or a tool or example, please feel free to enter these in the chat box, and we'll make every effort to share them with everyone on the call. Specifically, we'd like to encourage you to think about who else do you need to share this information with? What is one idea for action that you're taking from this webinar? What else do you need to know to take action and use the information? The Robert Wood Johnson Foundation has laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles regardless of where they live. So we start this webinar with this guiding question: how can the County Health Rankings and Roadmap help you build a culture of health in your community? This image comes from Cambridge, Massachusetts. They had all of their community partners put their names on a strip of fabric, then wove them together into a tapestry. It visually represents the power of collaboration to bring diverse partners together to create something new. Partnership, working with diverse partners from all walks of life, is one of the ways Cambridge is building a culture of health. So what does your tapestry look like? Is it helping you to build a culture of health? Similarly, the County Health Rankings and Roadmaps program is made up of many components that work together with a common purpose: to build a culture of health county by county. As we share the various components that make up County Health Rankings and Roadmaps, think about what piece or pieces of the program that you can use. Let's start by reviewing a little bit about the County Health Rankings. So this picture shows the thinking behind the rankings. Our theory of change about how rankings can be a catalyst for action that improves the health of everyone in the community. We start with population, based data from a variety of sources. Then we use that data to rank the health of nearly every county in every state. The rankings take several different pieces of data and simplify them. They give communities a quick and easy snapshot of their health and of the many factors that impact how well and how long people live. Each year, the rankings release, which was on March 25th this year, generates national, regional, and local media attention. Some of you may have read or may have been quoted in stories about how your county compares to others in your state. This provides an opportunity for people to tell the story of the many factors affecting health in a community. Community leaders can and do use the rankings release to get the word out to their community and local media to help people understand the health status in their community. They use the findings as an opportunity to mobilize multiple sectors to look further at their community's strengths and needs. And based on this deeper look at their unique priorities, community members identify evidence-informed strategies that can be implemented locally to make change. Over time, these evidence-informed strategies ultimately result in longer, higher quality lives for all the children and adults in the community. Essentially, the county health rankings aren't about numbers. This is such an important message. They are about a call to action. The county health rankings are a starting point for discussion in communities, not an ending point. Communities will want to dig into local data to further understand what's going on in order to know where and how to take action. Oops, excuse me. I got ahead of myself there. The horizontal portion of the model underpins the rankings. The county health ranking shows us that where we live matters to our health and that a broad range of factors impact how long and how well we lived. And this vertical portion that you see of our model underpins the roadmaps, the how-to. The roadmaps offers communities guidance, tools, resources to move from awareness to action to create healthier places to live, learn, work, and play. So we're going to start with the rankings. So here you can see the county health ranking, as I said, ranks the health of nearly every county in every state. And for each county, you find two rankings, one the health outcomes and one for health factors. There are two separate sets of messages to convey with these two groupings. How healthy a county is currently, health outcomes in greens, we call this rank today's health. How healthy a county might be in the future based on the many factors that influence health, health factors in blue, we call this tomorrow's health. Now, this is one of the most important images we'll share with you today because it shows what we use to determine the county health rankings and what influences health in a community. This model shows the relationship between policy, health factors, health outcomes, and it illustrates how multiple factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools, available jobs, access to healthy food, clean air and water, and our social connectedness all impact our health outcomes. So starting from the bottom, we know from research effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors, those in the blue boxes, shape our community's health outcomes. We specifically look at 4 categories: health behaviors, clinical care, social and economic factors, and the physical environment. We measure 2 types of health outcomes in the green boxes, as you can see on this model, to show how healthy each county is based on length of life and quality of life. As an example, a complete streets policy aiming at improving the way streets are designed to encourage walking and biking can influence health factors such as transit and diet and exercise, which in turn influences health outcomes. We often point to this image as one of our most important because it outlines what we use to determine the county health rankings and what influences health in a community. Because much of what affects our health happens beyond medical care. This image and the rankings that are based on it underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure our kids grow up healthy are top priorities. So having looked at the many factors that make up health, let's take a look how measures are selected. Some of you might have questions about this. So we want communities to take action, so we use measures that reflect aspects of a community that can be improved. Valid, reliable, recognized, and used by other similar national measurement or ranking projects. For example, many of our measures are used in America's health rankings, which annually measures the health of states. Our measures must be available at a county level for every county in every state. The data we use must be available at low cost or free and as up-to-date as possible. We use fewer measures, 35 in 2015, because the rankings are meant to be a snapshot, something truly usable for people in the community. This data is a starting point for communities. So having looked at the model and the measures, now we're going to take a brief look at a county example. So what does it look like on the website? So you can see here, this is our home page. Excuse me, I have to make one quick adjustment here. The navigational bar is at the top of the page. This navigation bar remains at the top throughout the site. It's a great way to navigate around the full site with just a few clicks from the bar. No matter where you are on the website, you can always scroll up and click on the County Health Rankings and Roadmaps logo and get back to the home page. So let's first look at the rankings menu. Excuse me. Here we go. Now we're at the right place. So we're going to look at, I said, the rankings menu. From here, you can access information about our approach, the rankings methods, using rankings data, measuring progress, as well as tools to help you understand your use of the data. Next to that, you can see the roadmaps menu. Here you can access the Action Center, which we'll come back to in a moment, what works for health, stories, project showcase, and national partners, which are critical to our work. And next to this, you see the RWJ Culture of Pride Health Prize, which I'll talk more about in a little bit. as well as the next menu item, which is More, which has, tools and resources, webinars, and a lot of information about our work, including our coaching program. So here in the middle of the page, you'll find a map of the United States and a search where you can enter your county or state by name, or you can also search for your county snapshot in the main search bar. Also below, I'll scroll down a bit, and below you can see that there's a drop-down menu in terms of selecting a measure to get more detail. So to begin to explore the rankings, we'll click on the map. And for the purpose of this presentation, we'll go to Wisconsin and then to Dane County, where we're based, the UW Population Health Institute. So as you can do with your state, I'm just going to click right on Wisconsin. Okay, so from the state overview, you see here on the left the green map of health outcomes and the blue map of health factors. From this page, I'm going to scroll down and see below here you can download data, you can find more data resources for your state, and you can also browse for stories from the community in Wisconsin, find community health improvement resources, and the contacts for the state, as well as a quick link to the Action Center, which we're going to talk about more soon. From here, you can go to a county snapshot that I was just talking about, and you can enter that. Let's see, excuse me, I have a sensitive screen today. So as I said, you can click here. I'm going to click here on Dane County, but I also could select a county up here where it says Select a County. So I'm going to go to Dane County, and here we see the snapshot. In the first column, you'll see our measures. We have 35 measures. We have the two overall rankings, the health outcomes and the health factors. You also find the rank for each of the health outcome and health factors. And here on the right, you see it's ranked 15 out of 72 in health outcomes and 2 out of 72 in terms of health factors. Your snapshot contains 4 columns of data. First, you'll find the county data. Here, we'll see data specific to Dane County. Next, we've included trend graphs for 12 measures where sufficient trend data is available. You can see a detailed graph of the trend data by clicking on the graph icons. And here, you can see the detailed graph of the trend data has color-coded with each icon to help you quickly see whether your county's estimate is increasing, decreasing, staying the same, with the red graph icons indicating your county's getting worse, yellow staying the same, and green indicates that it's getting better. So let's take a look at one of the trend graphs, and I'm going to scroll down here to social economic and see children in poverty. You'll see here that the blue, the county's trend is in blue, the state is in green, and the national trend is in orange. Those can be valuable to getting a picture of what's happening in your county compared to the state and nationally. You'll next see a column with error margin, We use a 95% confidence interval. Basically, this means that we are 95% sure that the actual number for your county is in a given range. The fourth column, you'll find top performers, top U.S. performers. This is in the 10th percentile for measures we are trying to decrease, such as smoking rates, or the 90th percentile for measures we're trying to increase, such as high school graduation. It's included as an aspirational value. Finally, you'll see the state column. This allows you to compare your county's numbers to your state's overall ranking. Also, as I scroll up a little bit here, you'll see this areas to explore, which highlights potential challenges a community may want to examine more closely. When you turn this feature on, orange boxes are highlighted from the areas to explore based on the health factor measures that seem to have the greatest opportunity for improvement. You see here the areas of adult smoking and excess drinking. The county snapshot also includes additional measures, as I'm pointing here, which provide some additional data that may be helpful to you, but it's not used to calculate the rankings. We have a new measure this year that I'd like to draw your attention to, and it's down in the area of social and economic factors, and it's called income inequality. And it's joined children in poverty as a measure of income in counties. This measure was added due to the growing understanding that not only the average level of income in a county is important, but also the distribution of that income among households in the county. As you can see, our measure of income equality is the ratio of household incomes at the 80th percentile to incomes at the 20th percentile. A higher inequality ratio indicates greater division between the top and bottom ends of the income spectrum. You can learn more about new measures on the Methods and Measures webinar, which I believe Kate is going to chat out to you. Now let's take a look at one of our measures. All right. There's a Measure tab, or by clicking, let's see. So I'm going to click on a measure from the snapshot. We're going to look at it more closely, and we're going to look at children in poverty. We looked at the trend graph, so let's see what the measure detail has to tell us in children in poverty. Takes a minute to load here. So you see here the measured, again, we're at the measure detail page for children in poverty, and for maps with individual measures such as this, we use the distribution of underlying values, better known as the z-scores, to display the spectrum of the values in a state. You can see in the maps above that the counties with particularly poor health values are colored a deeper shade of blue or green, whether you're looking at the factors or the outcomes, and the counties with particularly good health are the lighter shades. Once again, you can see we've progressed along the tabs at the top, and we have a new, so we've progressed along these, and now we have this new set of measures, of tabs. From these tabs, you can look at detailed data, see a full description, including why we use this measure, learn about the data source, and begin to browse relevant evidence-informed policies and programs from What Works for Health, which we'll talk about more in a minute. To the left, you see a brief description, a bit about the rankings methodology, and a summary of information for this measure. And I'll scroll down so you can see that. You can navigate to other measures from here, from this era, using the old orange box on the left. So now we're going to head back to the slides to take a look at the logic model again. So hopefully now you feel comfortable finding and using the county snapshot. Now let's go back to our thinking behind the rankings and roadmaps, which is while roadmaps addresses this vertical section. Now that we have our community's attention, we want to find the best possible strategies to impact our community's health priorities. This is where communities take action to improve health. But how do we do this? From working together to evaluating your efforts, the Action Center provides a variety of tools and guidance to assist communities in taking action. The Roadmaps to Health Action Center is an online platform which provides practical help for communities working collectively to improve their health. It provides guidance and tools to understand the data and the strategies that communities can use to take action. The Action Center also provides access to community coaches. So let's head back to the website. We're going to again return to our main page, and from here go to the navigational bar at the top of the page, and we're going to go to the Roadmaps resources. We can use this Roadmaps menu on the navigation bar to access the Action Center, and you can also access it by this icon that's where it says Get Step-by-Step Guidance from the Action Center. As I commented before, there's a whole menu of other links on this menu, and we'll get back to some of that information. So moving to the Action Center, you see that the Action Center includes our action cycle. And on this action cycle, you see that there are steps: access needs and resources, focus on what's important, choose effective policies and programs, act on what's important, and evaluate actions. And in the middle here, which is really the heart of this work, is community members and multiple sectors working together to create change. You'll see that communicate, let me make it so we can see here, communicate and work together circle the cycle, because working together and communicating with stakeholders are essential throughout the Take Action cycle. As you can well see, this image is interactive, and you can click on each of the steps or on any of the stakeholder bubbles along here that will take you to a guide for that step or for that stakeholder. Also, you'll notice here on the left, there's other links to get to the steps or to the stakeholder guides. So what will you find in the guides for the action steps? The guides describe the activities within each step and provide suggested tools, resources, and additional reading. You can start at assess, or you can hop in any point along the action wheel. Let's take a look at one of the guides. I'm going to click on Work Together. Here you'll find a brief description of the step, and you can see here the purpose and also who to involve. Scrolling down, you'll see that we've broken each step down into key activities, so you can find the most relevant guidance and tools for where you are in the step. When you find an activity that's of interest to you, you can open it to read the guidance and explore the links to the related tools. Each activity includes tools to help communities work through that part of the process. I'm going to click right now on Recruit Diverse Stakeholders so you can see where this leads. So you can see under Suggested Tools here, it has up to 5 visible tools, and if there are more than 5 for that activity, you'll see View All Tools, and you can click on that to see the rest of tools for that activity. Also look as you scroll down for Communities in Action, and their stories are scattered throughout the Action Center and What Works for Health. They provide examples of programs, policies, and tools in action. Here we see an example of a community in action, and clicking on that, you can see this is a United Way of Greater Toledo, and explains how they use 3 of the tools included in these key activities. So these community spotlights are intended to be quick examples that focus on the nuts and bolts of how work is done, key partners, and accomplishments. And don't you find it's always helpful to see how someone else has used tools or worked on a particular issue? So clicking back to Work Together, you'll see as I scroll up a Get Help box, which you'll find throughout the site, inviting you to contact our team for personalized free help. Clicking on Get Help will take you to an email form that gets to one of the 11 community coaches based around the U.S. who, thanks to the support of the Robert Wood Johnson Foundation, can be in touch with you to help you think about what is your next step or which tools might help. And all of this is at no cost to communities. So to learn more about coaching, we'll go back to the navigation bar and to the More link drop-down menu, and then click About. And here you'll see the link on the left to Roadmaps to Health Coaching, which provides local leaders anywhere in the country with direct support to community coaches to strengthen their capacity to advance health in their communities. This service provides guidance in how to best strengthen partnerships, enhance skills in a strategic manner, or navigate challenging policy and advocacy choices. This could be a short phone call or a longer-term coaching agreement. Most coaching is provided through distance learning technology or phone contact. Now let's go back to the slides for a minute. And here, let's talk about a summary of the foundation of roadmaps. So the roadmap offers community resources, as I've said, to move from awareness to action. And there are 4 foundations of roadmaps. It takes everyone, all of us working together to improve the health of a community, and we need to move as quickly as possible from data to action, not to get stuck in analysis paralysis or drowning in data. I'm sure we've all experienced that. and we encourage communities to look to the evidence to inform these actions. And if you innovate, be sure to evaluate. Also, it's critical to keep focused across the health factors, including the social and economic factors. And don't be afraid to take on policies, systems, and environmental change, which will, in the long run, create the greatest long-term change in health for the children and adults in your community. So let's take a look at a valuable resource we have, which is called What Works for Health, which provides communities with information to help select and implement evidence-informed policies, programs, and system changes that will improve the variety of factors we know affect health. In a minute, we'll head back to the website, but let's first talk about why does evidence matter? Evidence matters because when it comes to developing, and implementing solutions to problems that affect our communities, using what has been shown to work can drive smart investments. None of us have a lot of time, money, or resources, so choosing strategies that have been shown to work can help you stretch the impact of scarce dollars and resources. Knowing whether there are strategies that are effectively addressing your community's priorities can help inform decisions about when to adopt existing strategies and when to take more innovative approaches. It's important to understand what has been shown to work and what hasn't when creating new solutions. Explicitly considering what works can help to ensure that your innovative solutions are effective. So let's head back to the website to explore what works for health. We find what works for health, again, under the roadmaps, the orange navigation bar, and here you see what works for health. So on the right here, you see links to new policies and programs, so you can see the latest additions. On the left here, you can learn more about the ratings and the methods. As I said before, What Works for Health provides communities with information to help select and implement evidence-informed policies, programs, and systems changes that will improve the variety of factors we know to affect health. To learn more about strategies that could work in your community, select a health factor of interest, and I'll scroll down to the blue boxes here. So you can click on one of the blue boxes or enter in the keyword search. Let's take a look at the types of policies and programs that we find, and I'll look under income. And here we can see we find 14 results. From here, you can filter your search looking here by approach, decision maker, or evidence ratings. Each reviewed strategy is assigned an evidence rating based on quantity, quality, and findings of relevant research. When assigning ratings, we place the most weight on studies with designs that demonstrate causality. We consider study quality in conjunction with the design. If you click on a strategy, and let's see here, let's click on Increase Earned Income Tax Credit. And see on the right, you see it's scientifically supported. So clicking on this, we can see that then the full entry at a policy or program, including the expected beneficial outcomes and other potential beneficial outcomes. The expected beneficial outcomes are those that the strategy is directly intended to achieve. But we know that some strategies have other impacts. So when the evidence of effectiveness shows other areas that are also positively impacted by the strategy, they are listed here in the other potential beneficial outcomes. So continuing to scroll down, you'll see the evidence of effectiveness, impact on disparities, and implementation examples, as well as related policies and programs. So scrolling back up here on the left, you can see it also includes a community in action, which highlights how here the Kentucky Youth Advocates is working on a statewide earned income tax credit. You can find community spotlights sprinkled throughout What Works for Health and the Action Center. Look for examples how communities are using strategies, tools, and key activities in their work. So I'm going to click back one more step here, and here we can see the evidence rating. And if you hover over that, you can see the definition we have for all 6 ratings. So now we're going to head again back to the slides. So remember that evidence of effectiveness is one of the many factors to consider when choosing a strategy to solve a community health challenge. But it's also important to consider the community fit, readiness, priorities, capacity, and resources. As you may remember, earlier I pointed out on the main orange navigational bar the Robert Wood Johnson Foundation Culture of Health Prize. The prize, as it's called in a short name, honors communities whose efforts illustrate an enduring commitment toward creating a culture of health for all residents. Winners of the prize, the winning communities, receive a $25,000 cash prize. The 6 criteria displayed here show what drive the selection of the prize winners. We are looking for communities who are able to bring these criteria to life. You can learn more about the timeline for the next call for applications for the Robert Wood Johnson Foundation Culture of Prize by pulling down the menu under the Prize tab from the home page. So here you can see these are the prize communities for 2013 and 2014. And you can meet our winning communities and learn about their accomplishments on our website. Again, by going to the home page and clicking on the Robert Wood Johnson Foundation Culture Prize, then clicking in the drop-down menu on Winners. There you'll find inspiring videos about each of the winning communities. I still sometimes love to go to that just to hear about the amazing work that people are doing across the country. So the county health rankings help us see how we live, learn, work, and play truly influences how healthy we are and how long we live. The rankings are an annual checkup of the health of each community and each county. They show us that some places are doing very well and other places have a lot of work to do. Although, as we know, everyone can improve. Having health insurance is important, but much of what affects our health occurs outside the doctor's office. It's hard to live a healthy life if you live in an unhealthy place. Improving community health is not something solved just by a local health department or hospital or a particular physician. We need everyone to improve health in a community. All of us need to work together and to take action together. You can find practical guidance through online resources that we've shown in the Action Center and using the Get Help button to reach a community coach for consultation on your community efforts to improve health. We often refer to our coaching as a guide on the side, which so often life is a group project and we need help on the side, right? So now let's take some time to answer some of your questions, and then we'll have a few closing slides. So I'm going to turn it over to Kate.
All right, thank you, Mary, for that great overview. So we do have a couple of questions coming in, and the first one is, how are the different percentage levels in the rankings model determined? So those different level percentages that are associated with the health factors.
Thanks, Kate. That's a great question. And I'm going to just quickly move to the rankings, our approach, which has those percentages on it. So the overall factor summary score, it's a weighted composite of these four components, as you see here in blue: the health behaviors, clinical care, social economic factors, and physical environment. To calculate the health factors ranks in the County Health Rankings, each of the four is weighted based on an assessment of its relative contribution to health outcomes. So since there's no single correct weighting distribution, we arrived at weights drawing on a number of different perspectives: historical perspective, review of literature, weighting schemes used by other health rankings, analytical approach, and pragmatic stakeholder engagement approach. If you are interested, I'd like to recommend that for more information, you go on the website to rankings and ranking methods and ranking systems, and you can find a lot more information. Thanks for that great question.
All right. And we've got a question from Sylvia, a great question from Sylvia that came in. And it actually was about the what works for health. And she asks, how do we account for diversity in culture, race, ability, gender, sexual orientation in adopting evidence-based practice? And how do you engage the community in determining what it thinks will work based on its makeup and the resources available? So I will start with that one quickly, and then you can certainly add in. So this is a great question, and we hear a lot about evidence-based practices and best practices, and we like to say evidence-informed, and I always like to say it's evidence plus when we're thinking about what strategies will work in our community. So I would point you to our CHOOSE guide, our CHOOSE Effective Policies and Programs, where we walk you through how to think about what strategies will work in your community. So, you know, I always like to say there's a difference between what works and what works here. Those things aren't always the same answer. And so absolutely it's important to take into account the makeup of your community. We walk you through some different factors you should consider within the community context, within the resources that you have available in your community, and some things to consider and how to weigh those factors and as you say, involve and engage the community in coming together to think about what makes the most sense for our particular community and the particular challenges that we face and the assets and resources that we have to build upon. So, yep, definitely go to the CHOOSE guide and take a look at that there. The Work Together guide also has some information on how to engage the community, so that might be another great guide to take a look at.
I'll just add, Kate, with what you said, how important it is also sometimes timing. If you're a newly formed coalition, you may want to look at where is the most looking at all the factors that we've talked about, but also consider with a new coalition in particular, where is there most energy with the group of people that you're with, this cross section and cross sector of people that you're working with? Where's the most energy to start so that you can really mobilize the community and start with some win so that people can build on the effort and that other people are more likely to become engaged?
Yeah, absolutely. And Jolie's got another, I would say, sort of related question, though at a different part in the process. And she asks, what if a measure is rated as important by the community, but it's not included or weighted heavily in the county health rankings calculation? Does that mean it shouldn't be selected? With the concern that the outcome could be that they invest significant effort and resources and not really move the mark very much because it doesn't impact the overall health ranking.
Thanks so much for this question. I think a lot of communities face this challenge. And I think what's important is to just have a true conversation about it so that whatever decisions that you're making are really based on all the information. I often use the example in talking with people who are choosing priorities. How many times have you done something and in the beginning you were so excited and you thought it was important, and then once you're finished, you realize that it really wasn't the best choice in terms of your strategy and what we're focusing on. And it's very disappointing after all that effort. So it's just important to make knowledgeable decisions based on all the factors. And I think that has to be skillful communication and investigation and collaboration to come up with the right results for the right group.
Yeah, and I would also add that we've got some great resources on selecting priorities in the Focus on What's Important guide. So there's lots of prioritization processes, some that are very simple and sort of do just take into account what people are what are people most interested in working on. And there are some that really ask you to think about the lots of different factors that might influence what your decision would be. So it will take into account how many people are impacted by this issue. Are we making a difference in terms of health disparities or health inequities if we work on this issue? Do we have the resources to work on it? So it asks you to consider both, is there energy, is there interest, are there resources, but also, is this going to have an impact? And then you can look at your different options and rank them along each of those different areas. And so that way those different things are taken into account and considered as you're thinking about setting priorities. So it's not just entirely what are people interested in, but other factors are considered as well. So I would definitely recommend checking out the Focus on What's Important guide, in particular how to prioritize, to think about some of those things. All right, it looks like we have time for maybe one more question. And so keep sending them in, and we can always answer them offline if you have some that don't get answered on the webinar today. But the last question we'll ask is it possible to look at counties across state lines? All right, and I will take a start with that one. We get this question a lot. We know there's lots of counties that sit sort of on the border of another state, and they may look a lot more similar in many ways to those counties that are just across the state line. Here in Wisconsin, we hear that a lot from our counties that border Illinois and also the ones that border Minnesota. Within County Health Rankings, we, in our Compare Counties tool that's available, you can only compare counties within your state. And there's a couple different reasons for that, but the data that we use is really best compared within a state. In some cases, you can look at data across state lines, and we do have a tool on the website and tools and resources that will let you know which of the measures are comparable across those state lines and which you can look at but use some caution because you might be a little bit comparing apples to oranges just in the way that data is collected. So we hear this as a issue and a concern, and if you have a specific question about your county, you can always reach out to one of our community coaches using that Need Help button on the website, and we can help to walk you through how you might be able to look at that information. So, but for the most part, especially with that Compare Counties, it's right now only available within your state, and then that additional tool to help you look at what you can look at comparing across those state lines. All right, and Mary's telling me we have time for one more question, and she's going to do the wrap-up, so I believe her. So our last question that just came in is, how can counties that are so similar and sit right next to one another be so different in their rankings?
Thanks for this question, because I think a lot of times people have this question, and there are many possible answers. The population may vary significantly between counties. One county may have significantly higher premature death rate. This measure accounts for 50% of health outcomes ranking. We recommend that looking at local available data to understand this and what might be the unique contributing factors. So everything from also the income equality, what are all those factors that when you look at them and you can do the county to county comparison and really look at each measure, look at the trends and compare those, and you can see more by analyzing those side by side. What are the specifics of why there's such a difference in the rankings?
Yeah, and I think another really important thing to look at is the reason behind, the why behind that. We, again, as Mary stated in the beginning, we know that local policies and programs can really impact the health of a community. And so what's going on different in each of those communities that might be influencing how healthy those communities are? And is there something that can be done in a county to create a community where the healthy choice is the easy choice and where people have more opportunity to live a long and healthy life? All right, I think we are officially out of time for questions. If you have more, please send them in and we'll answer them offline. Otherwise, I'm going to turn it back over to Mary to wrap things up.
All right, also let's move on to let you know that the webinar, check out our upcoming webinars, and also all our webinars are archived, and you can find these at thecountyhealthrankings.org under More and Webinars. And also, many people have told us how much they appreciate our newsletter. And so be sure to sign up for a newsletter so that you can get up-to-date information and any news flashes that may be pertinent to you. Also, it's important staying connected, following us on Twitter, Facebook, and as I said, the newsletter. And lastly, back to the guiding question. We hope you feel inspired to reach out to others and take your next step. Wherever you are in your journey to building a culture of health in your community. But how can the county health rankings and roadmaps help you build a culture of health? So I hope that this question has been answered some for you, and thank you so much for joining us on the webinar, and we look forward to hearing from you in the future. And here's our contact information, and thank you so much, and best of luck on your efforts to improve the health of your community.